All right, so we're doing another Q&A with the owner, Jessica from Florida Kids Therapy Services, and we've been talking about a bridge, right? So like I keep imagining in my mind when you talk about clinical fellows and Florida Kids Therapy Services, you are the bridge between what actually happens and honestly like with other clinical fellows and how they experience life in the real world, having their own caseload and what that's like. So tell me a little bit about maybe how Florida Kids is the bridge and maybe like what you do differently when you're setting these clinical fellows up for success in the real world.
Thanks, Jen. I'm happy to be here. That I think starts with the heart behind it of creating great workplaces. And our first answer is finding the right supervisor. So
Mm,
we work really hard to find a good supervisor and someone who has a lot of experience and knowledge and care to give being the basis. We also, as a side note, we pay our CF supervisors because their time is valuable. And when you are getting paid and that being acknowledged that your time has value, you are much more likely to care about the product that you're putting out. So that's just a
1,000%.
side note for supervisors.
Mm-hmm.
Um, as a CF, looking carefully at the placement that you have as a CF and making sure as a company that we can support your placement that you're stepping into. Making sure that placement is going to have a manageable, even if it's a little bit under average, caseload for you to step into, and that your CF supervisor is available, able to answer your questions, and able to be on site when you need them to be on site. So those are kind of the basis of what we look at. We want to be a bridge providing training at the beginning of your CF year. Also, all of our therapists have access to a supervising therapist. Her name's Marlene, and she is the one who supports all of our therapists in the field. So
Mm.
going far beyond our actual CF year into your career, as long as you're with us, that you have great and amazing support forever.
What does support look like in the day to day with Marlene and having a supervising therapist?
hmm So I feel like the support specifically as a CF, which the supervisor is not necessarily Marlene. In that case, it can be any of multiple amazing SLPs, is having the ability to text, call, email with questions, um, and chat through different scenarios, chat through different student goals, chat through different IEP processes, and being able to do those in advance, but then in real time to ask your CF supervisor to have a mock IEP meeting with you or to have your supervisor come in and observe a group that's really challenging, or to have, I mean, we've even had some situations where we want a second SLP in the room when there's a really hard IEP meeting. And that's not common, that's very atypical, but sometimes knowing that you have somebody with you makes it so much easier to say what you know needs to be said because our ultimate
Mm.
responsibility is to the student. And when the situation gets diverted and stops focusing on the student, having an SLP in the room who can remind us of like, no, the 100% goal here is to serve the student as best as we can serve.
Mm. I'm writing this down. Ultimate responsibility is to the student. That resonates. And I feel like that'll resonate too with clinical fellows. So definitely something to consider as you are thinking about your placement and who your supervising therapist will be and what really to expect of them from that experience.